I'd like to turn to Governor Baker. Massachusetts is one, I guess, the seventh highest drug overdose death rate in the country. But recently, I just talked about this. There's a drop in this 2017
over
about
16, yeah.
Yeah, right, 5% already. Now, I know you've done a lot of different actions. And can you tell us a little bit about your experience and what kind of actions you've taken?
Sure. Let me start off by saying that I was Health and Human Service Secretary to Governor Bill Weld in the 1990s. I ran a medical group, and I was also the head of a nonprofit health plan that had about 1 million members called Harvard Pilgrim Healthcare and was #1 in the country for clinical effectiveness and customer service the last 7 years I was there. And yet, when I ran for governor in 2014, this issue was not anywhere on my agenda. It found me as a candidate. Pretty much everywhere I went, after I'd finished speaking, some people would come up to me and sort of mill around and talk to me about one thing or another. And then eventually they'd clear out and there'd be a few people left who waited until everybody else was gone and then said, "You're a healthcare guy, right?" And I'd say, "Well, yeah, sort of." And they'd say, "I got a friend." And then they'd tell me a story about their friend, which usually had something to do with opioids and addiction. And I heard this everywhere I went in Massachusetts. It didn't matter what neighborhood I was in. It didn't matter the socioeconomic demographic. None of that mattered. It was everywhere. And I finally went back to the campaign and I said, maybe I'm just listening for this, but I think something really big is going on out there because I can't go anywhere without hearing about this. And I asked some of the folks to just Google it and do whatever it is they did and come back and tell me. And so they came back and they said this: 80% of the world's opioids are consumed in the U.S. We represent 5% of the world's population. 240 million prescriptions were going to be written in 2014. 66% of everybody who gets admitted to a hospital gets an opioid prescription. 18% of those are still on it 1 year later, and 11% of those are deemed addicted. Now, 11% of 18 of 66 may not sound like a big number, except if you think about the number of people who get admitted to a hospital every day, that's a whopper over the course of a fairly short period of time. So at that point, I went and visited some of my old friends who worked in ERs, because that's usually the front line for a lot of this stuff, and some people I knew in the first responder world. And I just went to see them on a Saturday morning before I started campaigning during the day, and I said, "So what's up?" And, choose your word: avalanche, calamity, crisis, catastrophe. All of them said the same thing, and these were people I'd known for a long time. And so I kept saying to them, if that's what's going on here, how come you guys, I'm running for governor, how come you didn't tell me about this? And they said, well, we're just trying to keep up and, head down, doing the work, just trying to survive. So then I started talking about it a lot, and by some miracle, a Republican got elected governor of Massachusetts. And at that point, we put together a group right after we took office, about 15 very smart people, and said, give us a plan. And so they came back with about a 55-point plan, of which we've implemented a surprisingly large number of those initiatives, but they fell into 4 categories: prevention, education, intervention, and treatment and recovery. And on the prevention and education side, goal number 1, don't let anybody graduate from medical school, dental school, pharmacy school, or nursing school in Massachusetts without taking and passing a course in opioid therapy and pain management. Because up until then, the overwhelming message we kept getting from the clinician community is, I don't really know how to deal with this. And so for us, a big part of this was, well, you got to start educating the next generation of prescribers around this stuff if you want to have any likelihood of being successful at all with the front end. We also now require, based on a state law we got passed, that you can't continue to get relicensed if you're a prescriber without taking and passing a course in opioid therapy and pain management. We also started putting addiction experts on our boards of registration in medicine, dentistry, nursing, physician's assistants, pharmacy, sort of all the way across the continuum on the clinical side, because the other thing we figured out was that addiction is different for whatever reason than the rest of medicine, which is why, part of the reason why when you asked me to come, I said yes, because I think there needs to be a much tighter relationship between what goes on in the addiction world and what goes on in the in the traditional health world. We also created, as part of our state law, every year if you have a child who's an athlete in middle school or high school, you have to go to this health conference before your season starts, where your coaches, parents, players, and somebody who knows something about healthcare needs to be there to talk mostly historically about health issues, which was usually dehydration, concussion, stuff like that. We made them incorporate a conversation about opioids and pain and injury into that dialogue as well, because an astounding number of people, and again it's probably anecdotal, who kept following me around and coming up to me and talking to me had somebody in their family who got addicted as a result of an injury. And when they told me how much medicine was being prescribed for walking around after these people got hurt, 100 pills was nothing. I mean, it was flabbergasting. And I heard the same thing when I talked to people about the way workers' comp worked. Just mind-boggling. I don't know how else to describe it. So a big part of this was educate, educate, educate. Teachers, parents, coaches, prescribers, almost anybody that was anywhere near it. On the intervention side, we dramatically upgraded and improved the quality of our prescription monitoring program and really put some teeth into ensuring that people played. And after historically having maybe 50% of the prescriptions that were written in Massachusetts involve any kind of lookup on that, we've gotten to the point where about 97% of all the prescriptions that get written in Massachusetts involve a lookup of some kind, and pretty near universal participation among the prescriber community, which has been a really good thing, because not only do people find out what's going on with the person they're writing a prescription for, they're now also getting data about where they land relative to their peers who are also writing prescriptions in the space that they're in, who come out of the same clinical category. And over the last 18, 24 months, we've had about a 25% reduction in the number of prescriptions that are being written, and almost a doubling to about 5 million of the number of lookups that are actually taking place, which just shows people are thinking about this in a way that they hadn't historically. On the treatment and recovery side, we increased state spending on this by about 50% over the course of the past couple of years. Hundreds of additional treatment beds. We've trained about 1,000 recovery coaches, certified about 250 sober homes, which represent about 2,000 beds, which I've been in and out of a bunch of these. The ones that work well are a really terrific asset to people who are dealing with some of this stuff. And we also launched 2 stigma campaigns. I can't tell you how important this stigma issue is. There's a number of peer-to-peer groups for parents and family members who are dealing with this issue, and it's about addiction, period. And I've been in and out of a number of them. And I remember the first one I went to was in Cambridge, and one of the guys who was there said the first time he came to one of these meetings, he went to one in Salem, which is pretty far from Cambridge. And he said he went to Salem because he was afraid he'd run into somebody he knew if he went to the one in Cambridge. And he went to the one in Salem and ran into 2 people he knew from Cambridge who also went. And this is still a huge issue, and I think it affects who gets into treatment, who stays in treatment, and what the process to get people into treatment is. And we also just signed an agreement with the 9 social work schools in Massachusetts to help us get smarter about helping people think about how to help families prepare for, deal with, and incorporate the way they need to be processing this, dealing with this, and helping and supporting their family members. We also got a very big increase in our substance abuse and mental health piece out of our Medicaid waiver. Thank you very much to the federal government. And if I had to pick a couple things, I'd love to see the feds, and by the way, we did have a 5% reduction. First time in 15 years, the number of prescriptions, the number of deaths went down, 2017 over 2016 by 5%. If it hadn't been for fentanyl, it would have been a lot more. Fentanyl went from sort of 18% of the deaths in 2014 to 81% of the deaths in 2017. That is one brutal new wrinkle to this whole conversation. But if I had to pick 5 things, we have got to get to the point where you can't graduate from any kind of medical, dental, pharmacy, nursing, PA school without taking and passing a course in opioid therapy and pain management if we're serious about this. I actually disagree with you, Governor, on this whole issue about knowing what works and what doesn't. I think we're in the early stages of knowing what works and what doesn't, and I would love to see the feds go deep on this one, because the message I get from folks in the treatment world, many of them, is what they do they believe works. And the power of their faith and what it is they do is a big part of what sustained them all these years when no one was paying any attention to them. The problem with that in the long run is it may or may not be what works based on who somebody is, how they present, and what their problem is. And we do not have the body of evidence and the kind of muscularity in addiction treatment that we have in so many other areas in medicine generally. And if the feds could get serious about this one and really help all of those who are trying to help people deal with substance use disorders, it would make a really big difference. Because what works and what doesn't depends a lot on who you are, what stage of your life you're in, how it was you became addicted in the first place, and what it is you're addicted to, and what kind of family and other kinds of supports you have around you. And different people are going to respond to different things. And this is something that I think the federal government in particular could be enormously helpful on. The stigma piece, we've done 3 stigma campaigns. You can't do enough of them. I would love to see the feds take this one on as well and make that a big part of their conversation. Getting people to believe that this is a disease and thinking about it that way is a much bigger lift than I think most people realize. People here realize it, but as I'm out and about talking to folks, it's still a bit of a push in a variety of rooms that I'm in. Enforcing parity, yep, you bet. That's not just a state issue, that's a federal issue too. And it would sure be great if the feds could decide to make IMDs federally reimbursable, because they provide a heck of a lot of services that matter in this space, especially for people who are dealing with co-occurrence issues as well. I'm really glad you're talking about this. I'm very honored to be here, and I really appreciate your investment in it.